Hi, I'm Mary Jo. I have been a nurse for 51 years, and yes, I still have the RN to prove it. I have lost over 100 pounds as a postmenopausal woman and reversed chronic disease in my life. And I'm here to talk to you about the miracle transformation that occurred in my life with the help of nutritional science. I thought perhaps as I wandered through this world that a topic of consideration could be, so what is the standard American diet? What does it mean? And is there a problem? One of the reasons I ponder this is because there are people that are very significant to me in my life that have been diagnosed with extremely chronic and threatening conditions as well as terminal conditions. These people are younger than me or perhaps my age. And here I am almost feeling guilty because I can dance in the sun and they can barely stand and walk across the room. It just seems dreadfully unfair. And I believe that my energy, my vitality, my health is all related to how I've chosen to live my life now that I have found this magic plan. And that includes high nutrient plant based eating, exercise. I find that even after menopause, I now sleep extremely well, which provides much better healing for your body while you're fasting overnight. It's fabulous. Um, I also think relationships are very important, and I'll say stress management. But all I can tell you is that there is something in me that is just happier than I have ever been before. Maybe I'm just making enough serotonin to feel the joy of life. Who knows? So, what is the standard American diet? Does it have a problem? Well, all you have to do is Google standard American diet and you come up with standard American diet. 60% or more of what most Americans eat is either processed or ultra processed food. What does that mean? These are foods with a very high sodium, sugar, oil, saturated fat, and chemical content to them. Now, what do you think about all these chemicals people are putting in plastic bags of food products? I, I fear calling them food products because I think calling them something like fake food or, I don't know, what do junk food? I guess I can see the reason for the title junk food because do these things that we eat nurture our body, give us energy and joy, heal ourselves, ensure our immune systems are functioning top notch so we don't always get sick. And I think you'll find that most of those foods drag us down. They not only drag us down, they have what I would suggest is a highly addictive quality to them, probably interrelated to sugar, salt, oil, and perhaps the chemicals. You know, when I was a young woman, there was this advertisement on TV that said, you can't eat just one. And I thought, well, how clever is that? Until I realized, despite the food product being advertised was certainly not on my favorite list, I could not eat just one. Why couldn't I eat just one? It's something I don't really like that much. Addiction. Something in my brain said, more salt, more salt, more salt, or more sugar, more sugar. Oh, you've had so much sugar, you better have some salt. You've had so much salt, you better have some sugar. Anyway, a dopamine response was obviously part of what happened. I suddenly realized that American manufacturers and scientists, I mean, they actually, it was stated in newspapers, hired scientists to help make the food preparation so tasty people would want to eat more and more and more. The end result was addiction. It was not done out of malice. It just is what happened. There was a young student nurse in my clinical group one year, and she had traveled the world because her dad was in a military position. And she said, well, I can tell you one thing. It's the food in the U.S. is the tastiest and most desirous of food any place. And I thought, oh my God, that's addiction. Now, are you addicted to real wholesome food that nourishes your body and heals your soul? I don't think so. You can stop eating. You can feel hungry. You can enjoy and love the taste of the food. And you can say, oh, I've had enough food. It's time to go do something else. But when you're addicted to something, it's kind of like you can't get enough. And it creates, at least it did in my past, a human eating machine. It's like I had no choice but to be extremely overweight. So know this. If you're in a position that you don't like, it is not your fault. I felt used and abused, and that helped me begin to say no to processed food. Um, Always had a hard time giving up chocolate chips. Now, isn't that the weirdest thing in the world to want to hang on to? Oh well, let us continue. So, highly processed foods also contain chemicals. Now, have you ever wondered if the chemicals that you can't even enunciate that are part of what goes into that product, what the end effect is on your body? Well, when I was going for my second master's in lifestyle medicine, I found out there's something called GRAS or GRAS. It means generally recognized as safe. So, chemicals can be on this GRAS list, which means, okay, if that's the chemical and it's in this food product, or fake food product, if you will, then it's relatively safe. So it should be fine. Okay, so who makes the determination that the amount of this chemical placed in this food product is safe? I found out the manufacturers do. Now that concerns me because that seems like a little bit of a concern of what are their real priorities, selling the product or keeping the nation safe. Anyway, you can think about that. So, when you eat processed food, usually due to the sugar salt content, you get a skyrocketing of insulin, and that causes increased release of IGF-1. And these two hormones, when out of balance, cause atherosclerosis, which distorts blood vessels and makes it difficult to carry oxygen to all cells of your body. It leads to heart disease, kidney disease, dementia, just to name a few of the things that can occur. You have angiogenesis, growing of new blood vessels from old blood vessels, but unfortunately for primarily the purpose of the development of visceral fat in the gut and even in the chest that invade organs of the body and will produce cellular dysfunction. Also, the angiogenesis assists the feeding of cancer cells and causes cancer proliferation in the body. In other words, this is a recipe for chronic disease. Now, 35% of the American diet are animal products. And even though the essential amino acids are contained within animal products, and they do make people grow, in fact, they make people grow beyond the confines of their DNA. And there are some more recent studies that demonstrate heavy meat eating as both associated with fat gain as well as muscle gain. So it's not just putting on muscle, which is part of the problem. Anyway, animal products may have a little bit of B12 in them, but basically have negligible micronutrients, no fiber. There's a rush, a cascade of amino acids into the bloodstream, overwhelming the body, causing excessive liberation of IGF-1, insulin growth-like factor 1, manufactured by the liver, which causes a corresponding increase in insulin, and IGF-1 as insulin promote atherosclerosis angiogenesis, visceral fat, and cancer. So now we have a two-edged sword causing the development of chronic disease, even though it tasted pretty darn good when you ingested it. Also, meat products tend to cause a very high acid load on the body. One thing older women should be concerned about, if the bloodstream has a cascade of amino acids producing a decreased or acidic pH, the way your body can make that pH more normalized, and it seems to affect women a little more potently than men, but it affects both, is by liberating calcium and magnesium from bones, teeth, and muscle to cause the pH to rise to a more normal level. But that will leave you with problems such as sarcopenia, osteopenia, and osteoporosis, which can lead to a lot of painful deformity of the spinal column and leave one at risk, especially for hip fractures. So that is part of what will happen when you eat these types of foods exclusively. Now, another problem associated with it is, let us zero in on the lack of micronutrients. Lack of micronutrients in the foods you ingest leaves you hungry, perpetually hungry, in hopes that you're going to pick up something that has a vitamin, mineral, or phytonutrient that the body is longing for. So another thing is that there's a high caloric load to the processed food and to the meats or the animal products. And the end result associated with that high caloric load, well, your body wants to make energy. So your body can use it to make energy. Truly it can. But without the micronutrients to help the reactions to become more metabolically proficient, if you will, there is an increased development of free radicals. And free radicals in the body cause inflammation. And if you have higher and higher level of free radicals, they can cause a lot of cellular damage, a lot of an inflammatory response. Once again, I think you can see how the scene is set for the development of chronic disease. So the standard American diet has a great deal of processed food and animal products in it. So what does one choose to eat? Now, I've read several authors and I've looked at a lot of research, and the diet that comes out in my mind as providing the best and most excellent health outcomes is a high nutrient plant-based diet. I don't like to say vegan or vegetarian. I don't like to say plant-based, because especially out of Britain, you can find studies that suggest this type of eating style as commensurate with the inadequacy in protein and calcium. But that's because they're eating a low nutrient plant food diet. A lot of white potatoes, a lot of white rice, a lot of noodles. I mean, you know what, you can call yourself a vegan and you can have a white crusted pizza, and white bread is like eating sugar. I mean, it's going to rush into the bloodstream as sugar and increase that insulin and cause all of those problems to ensue. You can put some tomato sauce on it. You can put oil on it. Oil is 120 calories per tablespoon, and even extra virgin olive oil has 14% saturated fat. Why do you want to eat that? Whereas you can have a very healthy nut source of nuts and seeds to ensure that you absorb all those fat-soluble phytonutrients that you're ingesting with your vegetables. Isn't that a glorious idea? So, anyway, you can't just, if you just eating, it's not about just avoiding meat. It's not about just eating plants. It has to be more finely tuned to that which nurtures the human body. So out of all that I've read, I highly recommend utilizing many of Joel Furman's ideas associated with G-bombs and Dr. Michael Greger's ideas associated with the daily dozen. They're very, very similar, but have some differences in them. I like to take Mary Jo's plate, my plate, and develop it around G-bombs. Now, G-bombs are foods that are excellent in terms of helping your immune system to work efficiently and highly appropriately. I mean, I'm talking as someone who was sick all the time and now I'm never ill. It's wonderful, and it's because my immune system, despite the fact I've only gotten older, works in perfect harmony to keep me safe, and I am loving it, let me tell you. The other thing about G-bombs is that they are extremely capable at preventing and in some cases reversing cancer. So they're just an amazing way of protecting your body. When these foods are eaten, you also see reversal of heart disease and a lot of other dysfunction. You can find reversal of autoimmune diseases. It's just absolutely amazing. And if you stick with it long enough, you can sometimes get a significant reversal of allergies. But that's something that doesn't happen in a day or two. It takes a period of time. So my plate is as much G-bombs as I can get into it as possible, or at least in a day's time. I want those G-bombs on my plate. Greens and cruciferous vegetables, raw and steamed, or walked with a little sauce on them, with just a little bit of a nut or seed in the sauce, makes it delicious and much more absorbable in terms of the phytonutrients. Salads and salad dressings with maybe just a tad of nut or seed, once again, to make sure fat-soluble phytonutrients are absorbed, which will be 50 to 70% more with the fat source associated just prior to or with the meal. Anyway, legumes, they fill you up and not out. I think you can say that's true. They cause a low glycemic effect for this meal and the next meal. They increase fat burning capacity called lipogenesis. They are a weight loss person's friend. And they taste delicious when you learn how to cook with them. Very high in protein. And even though very, very high in carbohydrate, most of the carbohydrate is going to be lost, not absorbed. They create beautiful gut bacteria, butyrate, which has an anti-cancer effect on the bowel, and when absorbed into the bloodstream, on the whole rest of the body, as well as an anti-inflammatory effect. Onions, garlic, chives, antibacterial, antiviral, parasitic, fungal, you name it. They are fabulous. Also have some exciting flavonoids in them, such as quercetin, which is, once again, anti-inflammatory. Mushrooms, all sorts and kinds. They diminish aromatase formation in the body and prevent cancer. They are able to recognize abnormal cells and wake up natural killer T cells to create apoptosis of that cell. Berries are absolutely delicious. Now, other fruit is really a good idea. I'm not saying it's not, but at least a half cup of berries somewhere in your day. Berries, cherries, or pomegranates, due to their ability to create nitric oxide, relax blood vessels, and they also have a significant anti-cancer effect as well. Seeds and nuts, which I keep talking about, seeds have a very high nutrient density, so I don't worry, but I include probably more seeds in my diet than nuts. But you know what? I just love pistachios and walnuts, so I have to have a few of those. Anyway, can you eat more than that? Of course you can. And everybody's caloric needs are differently. You might need more protein, more calories. You might need more nuts than I choose to eat. You might need to add a significant amount of quinoa to your diet or other intact whole grains. I don't really want to discuss the components of bread that should be for another video. But know that most breads and bagels in the U.S. are the same thing as white sugar and create a caloric rush and a high insulin level, leaving you starving, devastated, wanting more food with high level of inflammation going on in your body. So, but intact greens are different, but worthy of another conversation. Dr. Greger's Daily Dozen is very similar. He just check marks, greens, cruciferous vegetables, like 3 fruits, and I'd have to look it up to give you the specifics. He does have more whole grain products in his Daily Dozen. I just am telling you, as a postmenopausal woman, I have to be concerned about that because it's too easy for me to get too many calories, more than I need to sustain healing and health in my life. So, I don't know. Did that make any sense? I hope so. Please take from this what is good for you, because after all, this is all about you. The standard American diet leaves most people starving to death because of lack of micronutrients and fiber. They don't have any satiation or filling, and they can become truly enormous eating machines, and it's not their fault. Eating a high nutrient, and be careful, because you can eat a plant-based diet, junk food, if you want. So it has to be a high nutrient plant-based diet. I favor the nutritarian diet and recognizing the importance of G-bombs in your daily regimen and food portfolio, with additions of other items as are appropriate for you, because remember, this is all about you, and without you, the rest of us would be lost. With love and appreciation in my heart for listening to me, thank you so much for your time, and have a truly beautiful day. And this is goodbye from Nurse Mary Jo. See you soon, I hope.